COVID-19. Let's work together. Australia and COVID-19. 26 million people around the world, more than the population of Australia, have been infected with the coronavirus, also known as COVID-19. However, this figure grows daily. A lot of people have died from the virus, but most people will recover. When we look at how coronavirus has affected other countries, we can see that countries with a low number of infections have less people who die and a much stronger economy. This is what Australia is working towards. Before COVID-19, Australia had a good economy, but the effect of restrictions and the shutdown of non-essential businesses means it will be difficult for the economy to recover. For the best chance of our economy to get stronger, we all need to work together to make sure the virus slows down. We want people to be healthy and strong. We want people who do get coronavirus to get the medical help they need so they can recover. We want there to be enough respirators to help people to breathe who get very sick. This can only happen if we reduce the number of people infected by the virus. When you and I do things to keep safe, like wear a mask and practice social distancing, we are helping everyone in Australia. When you and I get tested, even if we have only a slight cough or sniffle, we are helping everyone in Australia. When you or I stay at home until the test results come back, we are helping everyone in Australia. And if our test is positive and we stay separate from everyone else, we are helping everyone in Australia. COVID-19 is an illness caused by a new virus. There is no vaccination or cure as yet. The virus can spread very easily from person to person through close contact with an infectious person, even the 48 hours before they had symptoms. Contact with droplets from an infected person's cough or sneeze. Touching objects or surfaces like doorknobs or tables that have droplets from an infected person and then touching your mouth or face. These are some of the things we can do to keep safe. We can do these things when we are healthy and when we are sick. You can wash your hands often with soap and water. This includes before and after eating and after going to the toilet. Use alcohol-based hand sanitizers when you can't use soap and water. Avoid touching your eyes, nose and mouth. Clean and disinfect surfaces you use often, such as bench tops, desks and doorknobs. Clean and disinfect objects you use often, such as mobile phones, keys, wallets and work passes. Increase the amount of fresh air by opening windows. Wear a good fitting mask when you leave the house. Stay 1.5 metres from other people when you leave the house. This is called social distancing. The virus is sneaky and tricky. Even when we do everything right, we can still get it. But when all of us work together as one big community, we can slow the virus from spreading. The spread of coronavirus slows when we practice good hygiene and when we get tested, even if we think we might just have a cold or an allergy. If our test is positive, a whole team of people will trace who we might have accidentally passed the virus onto. We might not get too sick, but our friends and loved ones might get very sick. The virus makes some people sicker than others, but we can't tell who that will be. As we recover from the virus, Barwon Health and the Department of Health and Human Services will tell us when we can go back to being with our family, friends, and start working again. When our test comes back negative, it means we don't have the virus and we are not infectious anymore. We can stop isolating and we are safe to be with our families and friends. But it's important to remain alert. If any symptoms reappear, we need to get tested again. Even if we have already had the virus, it is possible to test positive again. This is very rare, but it can still happen. So even if you have had the virus, you need to continue with the same precautions. So, if you or I get tested at the slightest sign of a symptom, we are heroes. We aren't just looking after ourselves and our family, we are looking after everyone in Australia. Symptoms of COVID-19 can include one or more of the following: fever, chills or night sweats, cough, sore throat, tiredness, difficulty breathing, headache, muscle pain, joint pain, loss of sense of smell, loss of sense of taste, vomiting, diarrhea. It is good for our country to keep the number of people who have coronavirus low until a vaccine or cure is found. It means our economy will be able to grow strong again. There will be a lot of changes to how we do things, but when we all work together, Australia will be an even better place to live and it will be better for the future of our children. We asked someone from the Diversitat community about their experience of having a coronavirus test. He said that he was very scared about having a test, but it wasn't painful, just a little bit uncomfortable. The health staff were very friendly and helpful. When the gentleman found out that he was COVID-19 positive, all of his family in his household had to be tested and stay at home with him until the Department of Health and Human Services told them they can leave the house. He had to ring his friends that he had recently seen to tell them to go and get tested. None of his friends thought he had done anything wrong. They all went and got tested, and good news, this time no one else caught coronavirus from the gentleman. Even if a friend or family member did come back with a positive test, the positive person had done nothing wrong. Coronavirus is the problem, not the person. When the gentleman was in quarantine, he thought he would be very lonely. Instead, he had lots of people calling him every day. The doctor and a nurse would call to check on him. The police would check to see if they were staying at home, and his community made sure the family had food to eat. He had so many calls every day that he had to turn off his phone when he wasn't feeling very well. The person with the virus said it can be hard to start with because you might not feel sick, but you actually have the virus. You start worrying about how sick you might get, and you worry about the worst outcomes. But only some people get so sick that they need to go to hospital and go on a respirator. If you do get that sick, doctors and nurses do a very good job of looking after you. This person didn't get so sick that he had to go to the hospital, but he had headaches, sore throat, an aching body, and a cough, and he didn't have a lot of energy for a long time. There were days he felt unwell. There is no medication for coronavirus. Your doctor will tell you what treatment might help if you are feeling unwell. It is really important for all of us to help someone who gets coronavirus, especially if they live on their own. It is important for all of us to make sure they have food and medications and other things that they need to get by. No one can visit, but it is great for people to call on the phone. Talk about positive things, not about anyone you know overseas who may have died from the virus. That will make it much harder for them. Australia is a great place to live. We have good healthcare and education systems for everyone. It is a safe place and we have freedom. So let's all work together to help each other, to help our communities and to make sure Australia will still be in great shape for our children's future. Keep safe and get tested.